Prior to being diagnosed with kidney failure, I had a normal, healthy life. I exercised, I traveled frequently, I enjoyed life to the fullest. My 32-year-old son made the ultimate decision that he was going to be my donor.
I went to dialysis with her one time, and I saw what she had to go through. And just the whole 3-hour process, 3 days a week, I saw, how it had an effect on her body. So after I did a little research, I gave her a call and I was like, Mom, this is what we're gonna do.
I read the Grand Rapids Press, and in the front page of the press was a story about a man from this area, and he wanted to donate a kidney to a stranger. And when I read that article, my response was, oh, I could do that. And so that's how it started.
I remember reading an article about a woman who had a kidney transplant. Her sister was her donor, and I never forgot that.
We found out that this is like one of the best transplant centers in the, in the state as well as the country. So we felt very comfortable about that. So it was like, okay, this is, a done deal. Let's make it happen there.
The staff at St. Mary's went above and beyond in order to make the transplant a success.
They made you feel as though you were donating a kidney to someone in their family. It wasn't like you're just a number, this is what we do all the time. It was like a very personal type relationship.
The surgeons, the physicians, the nurses, the coordinators, all had a team approach.
Super professional, super kind, a wonderful experience overall.
He came to my room to visit me when he could barely stand himself. He was in excruciating pain, but his primary focus was not on himself, but on my well-being.
Knowing that she was doing well, and she almost had like a new outlook on life, so it was very rewarding for me.
It was the St. Mary's Kidney Transplant Program was putting on an event to thank the donors. So they were having a donor recipient celebration. And Missy Ostapovich invited me to come, and she asked if I would say a few words. But when we walked up, she was waiting for us downstairs on the street. And I thought that was kind of odd, but she said, come through this door. And then it all sort of clicked in a moment, and I said, is this Chris? And she said, yes, it is. And so that was our meeting, the first time we met. So when I hugged him, I said, are you okay? So mostly I want to know, how are you physically? On the phone he had said he had started walking. He was allowed to start normal physical activity. And he had, prior to the surgery, he really couldn't walk far. He was just weak. His body couldn't do that. Yes, I would do it again. Not that I'm allowed to do it again, but I have no regrets.
If it was, the same circumstance, definitely I would do it again. For my mother or father, it would definitely be something I would do again.
My life today has changed drastically for the better. I enjoy traveling. I enjoy exercising, walking, going to the beach in the summertime. Finally, I have a normal life, and I can enjoy it to the fullest.